So I think before we think about that, it's probably really important to also say that eating disorders can be incredibly isolating, and actually they often thrive in this way. We saw in COVID people relapsing from their eating disorder or developing sort of eating disorders. So support is incredibly important, but it can be hard to seek. Um, but saying that, when we're thinking about support, I think one key thing is to think about the right type of support from the right kind of people. So sometimes this might not be the person closest to you, and it's going to be different for different people. Often in therapy, we spend some time thinking about a person's support network and identifying who might be most supportive. Um, and in doing so, these are some things that we look for in what might be a supportive person. So it'll be someone that can really step back from your eating disorder and be helpful to you. Sometimes the person who's closest to us can understandably find this difficult to do. It'll be someone that you find easy to talk to about your eating disorder. Someone who's not critical or gets easily upset about your eating. Someone who's supportive, even if you're not making progress with your eating, because we know that recovery from an eating disorder is not a linear process. It's backwards and forwards. And the person supporting you, you'd want them to be there for you for that whole journey. Someone you can trust, and they're there for you unconditionally. So there's no threats, there's no strings attached, and also that they can be there for you in terms of frequency. So they're there for you on a more regular basis. What I'd also say is, if you are someone that's supporting a loved one with an eating disorder, that too can be quite emotionally challenging. And I just like to say that there are resources that can help you. So there's some really helpful books, information that's written by experts specifically for carers who are looking after someone with an eating disorder. There are also carers groups that people can access. And in the NHS, for example, if your loved one is receiving treatment, often these facilities are also available to you. Beat is a national charity that supports people with eating disorders, and they do some amazing work. They have a lot of resources on their website, and they also have online support groups for carers.